Unlike some folks who have to live in the West End, I chose to live in the West End. The reason that I got involved with CAB is because I love my community.
As someone who majored in public health, I see the importance of vaccines. I know for a lot of people, they think public health is just healthcare, but it's actually involving the community.
I think the main thing is education. There's a lot of misconceptions. There's a lot of conspiracy theories. Also, you have a lot of people in this community who don't have a relationship with their healthcare professional.
I'm hoping that we can let people know that, your health comes first and that there are people there who care about you and want to fight for your benefit.
Go to the website. We got tons of information for you.
Vaccines, going to the doctor, these things are for their benefit. And I just want to advocate for them to let them know, hey, I'm always on your side. You have someone that
Welcome back to Conversations with CAB. My name is Adriana and I am your host once again. Today we're going to accentuate the conversation about mental health and vaccinations. So with me, of course, I have another guest and I would like her to introduce herself.
Hello everyone, I am Dr. Ananicia Williams.
And can you tell us or explain a little bit about who you are and what you do for your career?
Yes, so it's a lot of things. And so I will say community connector, when you think about building relationships, because my background is in social work. So that looks like resources. That looks like connecting people to providers of care, but that also looks like what does it look like in understanding systems and the gaps and assessing and researching the many things that help make the community better.
So would you say you have a lot of experience with people and helping people?
I would say that, yes, I do.
And how many years have you been in the field? If you don't
About
mind?
10 years now.
And what made you choose to help people and play the role in the community that you do?
I think it's experience. So I will say personal experience, it shapes us and how we grow up and what we observe, but then also having access growing up and being able to see something doesn't seem right here. And I started off with a psychology background, but then I was like, I don't know if I want to spend additional years in school, and I learned about social work. So really understanding how do you engage and assess individuals to find community, but also find the things of the problem that they are identifying. So I think it happened organically of how I got here where I am today.
And I thank you for sharing that a lot and being transparent. So as we know, we've been talking a lot about mental health and vaccinations. So I want to ask you your personal opinion on how you first feel about vaccinations.
I will first say that individuals should feel empowered to make a choice. I have an understanding of what does it mean to actually be vaccinated? What does it mean in regards to the process, the after effects? So I encourage everyone to do your research and have understanding. I personally, when COVID happened, working in the healthcare system, I'm mandated. I had to get the vaccine. Did I question it? Of course. I will share, I did not vaccinate my daughter because I was still curious. I was still trying to understand. I wanted to be the guinea pig when you think about from a research perspective of, let me see how this works on me before I introduce my daughter to that.
Mm-hmm. And so also, you don't have to answer if you don't want to, but this is just, we want to get an idea of how you personally truly feel about vaccinations. Even outside of COVID, did you vaccinate your children, and has your family been vaccinated with, the common everyday vaccinations like MMR, HPV, those type of things?
So yes, because where we live, if you want your child to go to school, you need to vaccinate them. I will say, at that time, becoming a mother, this is what you have to do. This is what you need to do. So you go along with the process. As I have become more informed, I do ask questions now, so I have a better understanding. But I have been through the process of making sure at the developmental ages and checkups, my daughter was getting vaccinated.
So if you can just share a little bit about the positive side of being vaccinated and maybe the negative sides of being vaccinated. I just want to, get a little bit of an understanding of how deeply you feel about being vaccinated.
Honestly, I am curious of what is positive about being vaccinated. I know what healthcare systems tell us. I know that they speak about the data, the statistics, but I never see the long run, like what does it mean to be vaccinated? And so as I become more informed, I'll always question now before I act and do, because I have patient rights. And that is something that is important for providers to understand. I am for vaccination if that is what an individual wants to do. I think it's a personal choice. I think if it's going to impact a community, it's important to consider all options as well. So I'm not a yes or a no. I am be informed and make a decision individually, but also consider community if there is a larger impact too.
And I like that she said that, because she may not know, but I am a healthcare provider as well, and I'm all for patient rights. So can you kind of explain what patient rights are? It's more than a yes or a no. It's more than, okay, I just have to go with my instant feeling. Can you kind of explain what a patient right is and why that's important for people to know their rights in regards to being vaccinated?
Absolutely. So when people first get a provider, I don't know if they realize when they're filling out all of that paperwork, there is patient rights in that stack of paperwork. And so if you take the time to really look through that, it will tell you, like, I have the right to X, Y, and Z. So when you break it down and you really understand, I can pause whatever you are recommending. I can stop, I can ask questions, but even taking a step further to your patient rights of, you don't have to accept a provider just because that is what is given to you. So I share that oftentimes with individuals I work with that maybe utilizing their insurance. And so I say, do an interview. Like, is this the individual that you want to put your life in their hands? And so you may ask them, tell me a little bit about yourself and your background. Tell me what you think about bias in healthcare. Tell me what type of training that you have. How do you feel if I challenge you based off of your recommendation? That's building rapport, and that's important that you feel comfortable with an individual, because again, you are literally putting your life in their hands for your well-being.
And just your personal opinion as well to move along. Do you feel like there's a disconnect or there's an issue with those in the minority community, especially the Black community, with educating themselves on being vaccinated, not so much as getting the vaccination, but also becoming educated about them?
Oh, absolutely. Social media is so accessible today. We see things get put out in media where it's not great outcomes. Our people are so opinionated today. That's why you have to literally critically think and be informed of the information. But when I think about marginalized groups, and if we're being honest about the healthcare system, there have been some things that have happened to these Black, Indigenous people of color that has created them to be very self-aware and have some distrust in regards to, is this the right thing for me? Are you trying to create erasure amongst my culture and ethnicity? So we have to acknowledge that.
Yes. So in other words, she's saying read the fine print, know your patient rights, and also ask questions. There's nothing wrong with asking questions, especially if it's in pertaining to your health. Until the next segment.
Unlike some folks who have to live in the West End, I chose to live in the West End. The reason that I got involved with CAB is because I love my community.
As someone who majored in public health, I see the importance of vaccines. I know for a lot of people, they think public health is just healthcare, but it's actually involving the community.
I think the main thing is education. There's a lot of misconceptions. There's a lot of conspiracy theories. Also, you have a lot of people in this community who don't have a relationship with their healthcare professional.
I'm hoping that we can let people know that, your health comes first and that there are people there who care about you and want to fight for your benefit.
Go to the website. We got tons of information for you.
Vaccines, going to the doctor, these things are for their benefit. And I just want to advocate for them to let them know, hey, I'm always on your side. You have someone that's willing to speak out for you if you feel like you don't have anyone in your corner.
My name is Dr. Crystal Narcisse. I specialize in internal medicine and pediatrics at Norton Healthcare. In 2020, with the pandemic, because the hospital was full with patients with COVID, other patients were having delayed treatment because it exceeded our capacity. I never, ever want to go back there. The tides really turned when the COVID vaccine came out. The number of people having to go to the ER, the number of people actually having to be admitted to the hospital, you saw those numbers plummet. I was weary about the COVID vaccine at first, but I said to myself, if I can take a vaccine that'll help me to be able to keep doing my job to help people, I'm willing to do that. I don't take being a doctor lightly. I'm not going to tell you to do something I'm not going to do. I want you to be able to know that I have your best interests at heart. If I make sure that you're healthy, then I'm helping not just you, but generations after you.
Welcome back to another exciting segment. We're going to continue to talk more about vaccinations, especially in the Black community. I would like to ask you, when did the mistrust in vaccinations in healthcare start? And can you kind of pinpoint maybe in history, like some circumstances or situations that caused that?
So when I look back in just things that I've read, I study reproductive justice. And so a lot of that goes back to enslavement. So really understanding what did birthing look like during times of enslavement. When you consider that our bodies did not belong to us, we were also forced to labor, and that means not only in the field, but like actually labor and produce children, because things were happening that were very traumatic that was forcing us to be pregnant and birth. And what you will find is that individuals would become pregnant, oftentimes not by their choice, not by someone they would choose to be with. And the things that they went through in regards to the birthing process of, I am not getting anything to assist with the pain of my labor, are children dying. So when you think about infant mortality, we have high rates of that. That is all connected back to enslavement and things that were happening. We could even talk about maternal mortality, and I wish we had more time, but there's a historical context. And when you think about, there's a great book that I want to recommend, is Killing the Black Body by Dorothy Roberts, that takes you on a level of history that you probably did not know, or it will make you say, that makes so much sense when you think about our wounds and the trauma that we store as our ancestors and it's passed through the generations of, there are some things that was really uncomfortable. And that's why I'm keeping it very light, because I want to encourage others to take the time to learn for themselves. But enslavement is definitely the time that you could go back and understand the same things we're seeing today.
Would you be open to sharing maybe more of a historical point and where the mistrust went wrong as well, outside of enslavement as well? Like, were there any other times in history that may have caused people to have a lack of mistrust in providers or even in vaccinations?
Yeah, so a lot of people refer to Tuskegee.
Yes.
That experiment. So thinking about research, our bodies were exploited. You were extracting information from us so that you can gain in regards to knowledge on how to take care of Americans. And when we think about Americans, it's not the individuals that are of color. Gynecology. A lot of people bring up Marion J. Sims. He literally experimented on young teenage Black girls and put them and prompted them up on a table to be displayed as they did not receive any anesthesia. So those are things to uplift. But what I always try to share with people, while we have the knowledge of history, I don't talk about Marion J. Sims. I talk about the individuals, Anarcha, Betsy, Lucy. Those were our foremothers of modern day gynecology. And that's how you shift their perspective. That was the contribution to how you understand gynecology today.
So for those who are still have that mistrust, even today, we know, like, older folks as well, and for the younger folks, what would be some advice you would give people to get like normal checkups, or just to educate themselves, not to necessarily get procedures done, but to educate themselves about health in general, because we know health is very important. So would you have any like positive advice, especially for women, on, how to trust again?
Absolutely. Representation. So if I see someone who looks like me, that could pull me in to say, okay, There's a sister. I want to learn. I want to see if you're the right fit for me. I don't think healthcare system realize how important that is. And I don't mean just Black people. I mean Indigenous people. I mean being able to speak people's languages and their culture. And from an individual perspective, look on the websites, see who the providers are. If you don't get on the website, can you call? Can you ask? I would like more about the provider, their background, because you can Google, you can search people to understand what is their thoughts and process about implicit bias. What is your training and background? How do you feel if I question you on your recommendation? Because sometimes with providers, that could create a disrupt in that rapport building, but your patient rights allow you to ask questions, and everyone should do that for themselves.
Yes. And as you said, ask those questions, get the needed information that you need to make the best healthcare decision for yourself. So along the lines of healthcare, I want to tap more into mental health, your therapeutic side, if that's okay with you.
Yeah.
So can I ask you, how do you feel about mental health, and what is your definition of mental health?
Mental health affects everyone. Everyone does not have a mental health diagnosis. But when you think about it, say you're driving one morning and you're on the road and you see a car accident. Why it did not happen to you directly, you could still be impacted indirectly. Some things can come up in your body, because that's a lot of the times people don't realize is there are different things happening within your body that is sending signals to your brain of, is this safe? Or it may be telling you that danger, alert, but then it may have you freeze. And so what I'm referring to is what happens a lot with people with post-traumatic stress disorder. And so if you've ever experienced something that has been an event or an experience that was uncomfortable, disrupted you, is what I think about mental health too. COVID, that was a disruption to individuals, to systems, to communities, that it has shifted the way you navigate life. That's mental health, really, like how you navigate and shift in your experiences that have an impact on you. And most times people don't realize it's impacted their mental, but somatic symptoms, because of what's going on in the physical body, is usually an alert and a signal going off for people.
So what are the common mental health issues that, in your experience, do you see that the community struggles with?
Anxiety. I don't think people realize how much many of us struggle with anxiety, that anxious feeling, that worry, and anxiety is a threat. And so it could be something that has not even happened to you, but you already may be thinking the what ifs. So if I go into this job interview, what if they don't hire me? And so you become like alert, sweaty palms may be happening, your heart palpitation may be happening as well. That's anxiousness, but that doesn't mean you have anxiety. There are things we do as practitioners to actually assess to see like how often, how long before we come to the recognition that you may have a diagnosis. And I want to be clear on that, because people can have symptoms, but they may not have a diagnosis.
And so do you feel like there are any barriers for people who have mental health issues, or what are some things that, aid in people having mental health issues, especially after COVID?
I think about our children. I think about our parents. So parents having to assist their children in navigating NTI. Parents having to navigate work, having to shift their whole schedule. They may have lost a job because of that. They may have been impacted economically. They may have been impacted with housing. And so you have to also consider that that's an event, that's an experience. Of course, I am going to shift in my way of thinking or how things impact me, where I may become overwhelmed and anxious about what's next. I have to figure out how to feed. And then our children. Kindergartners were literally signing on and logging into a screen and having to adapt to this new culture of learning. Teachers, we're seeing burnout. That is also an impact of mental health.
And that's a very important topic that we will touch on in the next segment. Thank you for watching.
Unlike some folks who have to live in the West End, I chose to live in the West End. The reason that I got involved with CAB is because I love my community.
As someone who majored in public health, I see the importance of vaccines. I know for a lot of people, they think public health is just healthcare, but it's actually involving the community.
I think the main thing is education. There's a lot of misconceptions. There's a lot of conspiracy theories. Also, you have a lot of people in this community who don't have a relationship with their healthcare professional.
I'm hoping that we can let people know that, your health comes first and that there are people there who care about you and want to fight for your benefit.
Go to the website. We got tons of information for you.
Vaccines, going to the doctor, these things are for their benefit. And I just want to advocate for them to let them know, hey, I'm always on your side. You have someone that's willing to speak out for you if you feel like you don't have anyone in your corner.
My name is Regina Ficarico. I am currently a paramedic for St. Matthew's Fire and EMS. I was a brand new paramedic at the start of the pandemic. Our hospital systems were just not prepared for the sheer volume of sick people that we had. The vaccine helped a lot with severity of illness. Anybody that I've talked to that have had COVID pre-vaccine and post-vaccine, it was a lot easier to deal with, like the days were shorter. I really push forward for patient advocacy. Every person that I come across, I am going to treat you as a close friend or a family member. There's a lot of fear of healthcare, especially Black and brown individuals have had things put against them. I do the best that I can to alleviate some of those fears. While they're here with me, I'm going to take care of them, and I'm going to take them to a place that's going to also take care of them best I can.
We are back with our very last segment of Conversations with Cab, and we're going to continue to talk about mental health because we know it's very important. So I just want to ask you personally, maybe some coping mechanisms or strategies that people can use to help maintain their mental health.
Sure. So outside of going to a therapist, and let me also say, everyone is not at that point that they want to start therapy because therapy is work. It requires looking at yourself and going within, and it may bring up and stir up some things. So timing is also important. One thing, movement. You gotta move your body. And if you can't get to a gym, can you get outside and walk? Can you get outside? Now we're, spring, heading into summer, get some sunlight. Allow your body to just sit there and take in the sun. Nutrition is important too. And I know that can look different for everybody as far as when we think about food deserts and accessibility, but that's why it's important that people get connected to organizations that do some really amazing work. I'm gonna shout out Change Today, Change Tomorrow, that gives out free groceries to the communities on certain days. The other thing is being okay with not being okay. And so really acknowledging what's coming up for you. I will say in practice, a lot of people cannot identify what they're feeling. Journaling is something that people push back with me. But what I tell them, I don't care if you're writing one word. I don't care if it's like, I don't know what to write. Voice notes is on your phone. Let that out of your body of what you're holding, because oftentimes that is where we see diseases coming up. Like when people talk about having bad headaches, which is related to stress, sometimes we need to release what's happening and being stored in our body as well. And those are just a couple of things that people can do.
So how does self-care also positively impact one's mental health? Because some people don't think it makes a difference, but we as healthcare professionals know it does. So can you explain about that as well?
Yeah, and I will say self-care has been co-opted. And so a lot of people bring it up and they talk about it. It's more than your bubble baths and, relaxing. It is really about being, intentional. So if you know you are someone who needs to set your alarm and say, I need 15 minutes to myself to regroup and just sit with self. So like mindfulness, meditation, these small strategies can be monumental for people. And some people struggle with just sitting with themselves, their thoughts and what's coming up for them. So then I will say, can we do some journaling? Can we talk about like what your mind is just like coming up with thoughts and ideas and whatever is happening? I'll say music is therapeutic too. Whether you write music, you play music, you listen to music. So I encourage those that I work with, when you cannot find the words to say, what is your go-to song that you turn on that speaks to your heart and your soul.
And so, how important is it to seek out a therapist? What role does therapy truly play when it comes to dealing with our mental health?
I want to also encourage in the healthcare system that we have therapists a part of the multidisciplinary team. So if you have an MD, if you have anesthesiologists, if you have your caseworker, I think a therapist should also be a part of the treatment plan, because that therapist is assessing. Before anything ever happens, we're assessing to understand what's going on with you. When we think about aftercare treatment, a therapist can be involved and really understand, what does that recovery look like? Are you seeing a shift in like your mood? Are you seeing a shift in maybe some of the things that you've been prescribed for medication? They really want to understand the whole person. So therapy is understanding yourself, but it's also identifying a problem that may be coming up and getting to some goals and potentially solutions that work for you. But there's no time limit on how long you could be in therapy. It could be, I set a goal, I hit that goal, we celebrate, and then you may think, well, now I want to move on to the next goal.
So it's always good to utilize your resources. A therapist can be a resource, a provider, a friend. Anyone can be a resource to help you maintain your mental health. So personally, have you ever struggled with mental health issues?
I have. I will say mine is more like in silence. And I know as a therapist, and we talk about the stigma, but then also I think trying to understand what was going on with me. So today actually marks the anniversary. Last year, I was in the hospital because I experienced a miscarriage. And it was actually an ectopic pregnancy. And I was in go mode because I was trying to wrap up school. So I was trying to work through that, but eventually go to the hospital. And you're hearing all of these terms and hearing things in regards to, well, we're gonna have to remove an ovary, you know? And you're trying to understand, but also make a decision in that moment of, I'm in pain, I don't know what to do. I went into surgery, the doctor slowed down, I had a DNC. Afterwards, what I realized is I went back to go mode because I still had to show up for self, community, and all the other things. But eventually I started seeing some things in regards to my mood. I became very short with people. I was very irritable. I isolated a lot. I was experiencing depression and postpartum depression. And a lot of people don't realize, even if a person doesn't follow through and actually brings a child home from childbirth, you can still have symptoms that occur in regards to postpartum depression and even anxiety. I already had a therapist in place, so we've been working through that. We continue to work through that. It feels good to talk about it openly because oftentimes we don't even think about pregnancy loss and the impact it has on someone's emotions and their mental well-being. It disrupted my relationship. And so that was a loss and grief in itself. So there's so many things that impact one's mental well-being that, again, I go back to events and experiences. And if you don't take the time to reflect on what's going on with you, it can hit you and then show up in your relationships and how you interact with people and community.
And so how did therapy and how did your coping mechanisms affect you in that moment? Did it help you? Did it hurt you? Is there something more you felt like you could have done? And I'm just asking that so, you know, other women who may be in your position can kind of relate to you.
Yeah, community. I have a really great friend that went out of her way to, she made she ordered like these rainbow cupcakes. So just to signify the loss. And so that was acknowledgement for me, because oftentimes people don't acknowledge something as pregnancy loss. But then also having that safe person that said, you can talk to me, gave me permission, even though I wasn't talking to my therapist about it at that time. That began to open up that layer that then when I did go into therapy, I began to say, I'm angry, I'm mad, I don't know what to do with this, I don't know what this means for my reproductive health. And then having these conversations with my primary care provider of like, this is what's going on with me. Like, I'm thinking about my reproductive future and I want to discuss that with you.
And that was so powerful. And I know a lot of women out there can relate. We talk a lot about women's health as well, and I would like to slightly touch on men and how mental health has impacted men after COVID, and if you've seen any difference between women seeking help with mental health or men seeking help for their mental health.
I will say men are not different. I think that they have their own struggles with their mental well-being. What I love that I see today is there is space that acknowledges them, that sees them. So I see men doing yoga. I see them practicing getting in touch with their body. Social media has really shifted things to where I see Black men stepping up and talking about, I'm sad because I've experienced loss. I've lost a lot of brothers. And so now I want to talk about that, how that hurts and harms me and impacts the relationships that I'm in. I think men are healing. I think it looks different. And I think that they experience symptoms different that everyone may not be aware of. And so when we see aggression and how that shows up, do we understand behavior? Because behavior does have meaning, but oftentimes we don't ask people what's going on with you, what happened to you, and that's so important.
So what would be some advice you would give to the men out there who are not seeking mental health because of the lack of trust in that area?
I want to acknowledge that men gather, whether that's the barbershop, whether that's amongst each other and they're having a kickback. So talking things out, what you're holding and going through, that's step one. Like that's therapeutic process, that the fact that you're actually talking about your life experiences and what you're holding. The other thing is we need more men providers. There's not enough men of color providers as well. And so I'm encouraging those to, go seek out becoming therapists, even becoming a peer support specialist, because that's an option. A case manager, that's an option within healthcare too, that people don't realize. Case managers can literally connect you to resources in the community. It may be making sure you get to that job interview. It may be making sure you understand what does therapy look like for you too.
And so before we close out, can you quickly list some resources that a lot of people may not know of to help them with their mental health, their healthcare, postpartum, even getting educated on vaccinations?
Absolutely. I will list that you have 211, of course. You also have 988, which people can call and actually talk to someone 24/7 for support. I also want to uplift, you have communities like Change Today, Change Tomorrow, which focuses on food injustice. So that's a part of the mental health well-being too, is what we're putting into our body. I also want to uplift Essential Embrace Healing, who is also a small private practice. And people don't realize you have the 7 counties, you also have the mental health hospitals, but there are a lot of mental private practice individuals that show up in community. I would also encourage social media. And so reach out to those providers that you're aware of that can connect you to a therapist or a provider, and call the back of your insurance card because they should also have a list for you.
We thank you so much for educating us and giving us a piece of knowledge that we may not be able to have taken with us. I hope you guys enjoyed this episode of Conversations with CAB. For further resources, go to www.westlouisvillecab.com. I am your host, and I look forward to seeing you soon. Thank you.